It's 2 minutes past 2 in Bali time, so I think we're just going to go ahead and get started. As I was saying before you logged on, this is our first attempt at a webinar, which is essentially an online presentation, really giving a background introduction and making a compassionate plea for sponsorship and donors. I will be going through some slides. I'm going to try to keep this to about 20 minutes, 25 minutes max. But we will be holding another webinar on the 11th, where I'm leading the communications in terms of reaching out to corporates, NGOs, VVIPs to try to elicit their attendance for the 11th as well. But any effort or support that those of you who are on this call can provide in increasing awareness would be greatly appreciated. So I'm going to share my screen now. If anybody cannot see it, please let me know. Okay, so the intent of the presentation today is to go through Yayasan Solemen Indonesia's 5-year plan. Now, this is a very comprehensive document. It's 70+ pages with a lot of nuance to it. I certainly won't be delving into that level of detail today. What we will be doing is going through an introduction from myself, an introduction in terms of context to healthcare and the resources required in Indonesia. There will be a message from Robert Epstone that he recorded. I'll then go into a couple of case studies, and then I will outline at a very high level Solemen's 5-year plan and the areas of support for potential sponsorship or donations. Now, I cannot emphasize enough, I'll say it again multiple times during the presentation, but the reason I'm volunteering for Solemen and the reason we put this together and we will be doing a concerted push over the next month is that literal lives are at risk. Solemen is looking after thousands of people. More and more every day are turning up, and funding is running out. So this is a very time-sensitive issue, as you know, Solemen is a very passion-driven organization, and we're all passionately trying to continue to provide care. In terms of background on myself, why am I speaking to you? So my name is Chris. In terms of my background, I've been working in the international healthcare industry for nearly 10 years as a senior executive, but I have a personal connection to Indonesia. I grew up here. I moved to Jakarta when I was 10 from the US. I graduated from international school. And after university, I joined a global medical assistance company, the world leader in this space, called International SOS. Because I speak Bahasa Indonesia, they brought me back. I then ended up having regional roles, not just in Indonesia, but for a good 7 years, I was the regional director. And in that capacity, that afforded me the opportunity of not just sitting in a comfortable corporate role, but it's a very operations-driven business. And I bounced all around the country, from Papua to Central Kalimantan to North Sumatra. Oh, sorry, let me just let a couple other people in. Hi, everybody. Thank you for joining. So we were just getting started, and if you can please keep your microphones on mute, that way there's no feedback. So as I was saying, I'm just giving context to myself and why I'm speaking today. So in my role at International SOS in Indonesia, before I left to other roles around Asia, I had a lot of experience on the ground. So that photograph you see on this screen is a picture I took in West Papua of an evacuation that we organized from a remote mining exploration site. I've been on the ground in West Papua and Central Kalimantan, all over Sumatra. I understand the variability of healthcare and infrastructure that is available in this country. And when COVID-19 hit, I'm now no longer working for International SOS. I'm working for a health tech startup around Asia. But I understood the strain that was going to be put not just on the economy, but on healthcare resources. It's very counterintuitive. Everybody thinks during a pandemic, hospitals are overrun. ICUs can be, but many hospitals are losing patients who are afraid to go to the facility for elective treatment. And so they're losing revenue. The resources available to them are diminishing. This is happening around the world. And so I reached out, I did my due diligence, and I was very impressed by the team at Solemen and their mission. And more importantly, with COVID, I knew it was time sensitive. So I've been volunteering and engaging with Sarah, Robert, and the team for the past few months. Just for further context for those who are not as familiar with Indonesia, especially the healthcare landscape here. Now, Indonesia has made humongous strides in terms of healthcare resources available over the last, let's say, 10 to 20 years, including in specializations like cardiology, where they have quite a good breadth of doctors available. Nonetheless, it still remains one of the least favorable doctor-to-patient ratios in the world. Medical error also remains rampant. Doctors are not required to have ongoing medical education after they graduate. Malpractice does not exist here. So there's still a number of issues. The government quite virtuously has set up the National Health Insurance Scheme, BPJS, that has dramatically expanded healthcare access to millions of Indonesians who did not have it before. Yet it's not the end all and be all. As you can imagine, there are a number of issues that they're still trying to work out. So many Indonesians are still slipping through the cracks. Now, when you talk about mental health in Asia as a rule remains very largely stigmatized in comparison to Western countries. That isn't to say in countries like Singapore and other places that there isn't an increasing awareness and availability of support. But in countries like Indonesia, Vietnam, even Malaysia to some degree, mental health is a topic that remains taboo. It's not addressed. Patients don't often have access to the resources they require. And the World Health Organization estimates that in Indonesia, the prevalence of severe mental health disorders across the population is nearly 2%. So when you're looking at a country of over 200 million people, that's a significant number. So the reason I framed all of that is the limitations of available resources in Indonesia that I'm very familiar with due to my background leave significant and substantial gaps open to charities and to other organizations like Yayasan Solemen Indonesia to fill, and fill that they do. Yayasan Solemen Indonesia is providing very, very crucial and very needed support to high-risk individuals and populations in Bali, which I'll be demonstrating. So I can, Janet and Amanda, would you mind muting your microphones, please?
Okay.
Thank you. As an example of that, in Bali, there are many villages that have never even seen a doctor. So despite the strides that Indonesia has taken, there's a long way to go. And that's where Solemen Indonesia steps in. Now, being that I spent part of my childhood in Indonesia, I'm very familiar with some of the things here. And I was dubious, to be quite honest, of volunteering my time with charities. Some of them have been associated with some unscrupulous behavior. Can you actually trust them? Now, I surveyed a whole bunch of them, and you can ask anybody around the island of Bali, Solemen stands out as one that is transparent. It has the reputation, it has the support, ranging all the way up to the heads in terms of government officials in Bali. And also the team around it, the ethos, the credibility, the mission driving it. And a lot of that starts with Robert, the founder. Now, Robert has an extremely interesting background for those of you not familiar with him. Robert has worked in the music industry. He's been an executive in high fashion, a designer in high fashion. And across all of these different experiences and periods in his life, the most impressive thing is that he's always remained committed to providing care to charitable works to some very extreme locations, war-torn settings. As an example, in Peru, as you can see an extract from an article here, Robert was actually very severely injured in a terrorist attack when he was with the BBC filming a documentary to expose the drug trade and deforestation. Robert compassionately provided charity in Albania, risking life and limb when there was a war ongoing, entering to the country when other people were fleeing. And when he started and came up with the concept of Solemen, he actually embarked on a 500+ kilometer walk across the island of Bali, barefoot, no shoes on his feet. And he did that to show solidarity with the underprivileged here who could not afford shoes. Thus the name Solemen. And until very recently, Robert actually continued that walk of solidarity. He never wore shoes, but for health reasons, he has had to do so recently. Okay, what I'm going to do now is play for you a short video, about 2 minutes, Robert recorded. These are words from the founder himself, and then we'll carry on. If you cannot hear the video, please let me know.
Well, firstly, apologies for appearing in my hospital gown. I've been in KL for the last 2 months with lung cancer surgery and some other bits and pieces. I'm now absolutely fine. I'm looking forward to getting back very shortly to Bali to take the reins again at Solemen with my team. You know, since starting the charity just over 10 years ago, Solemen has managed to do so many outstanding things, helping to change lives in Bali. We've lost more than 90% of our funding since the pandemic struck in March. Almost all of our funding came from the hospitality industry, which has been decimated, causing so many to lose their jobs, resulting in an even greater need for our services on the island. This has resulted in more need to secure food to distribute, monthly costs $5,000. More need to continue our medication for our mental health programs, currently running at $7,000 a month. More need to expand our sustainable gardens, including our aquaponic systems. More need to keep our outreach team on the road daily to continue to provide care and medical assistance for so many. More need to keep our care and recovery center going. More need than ever to keep going and expand our services. I don't want to use the word beg, but I implore you to really help us if you can possibly help us in the ways I've just been describing. We need to continue. As I said, we've been going for 10 years. We have a proven track record. We're transparent. We do an astonishing amount of good on a daily basis. We want to continue. It's a needed service for Bali. So please help us. Please share. And thank you for really anything and everything that you can do for us. Thank you for listening. On behalf of the Solemen team, thank you.
Terima kasih, Solemen.
Thank you, Solemen.
Solemen really help the children and also my grandson.
Solemen, thank you so much. Terima kasih.
Thank you, Solemen.
Okay. So that was from Robert himself. As you heard at the beginning of that video, unfortunately, Robert has been dealing with some medical issues. He had lung cancer. We managed to get him, very fortunately, into Malaysia. The situation, he's had surgery performed. Thankfully, he's fully recovered. He's very healthy now. He's back in Bali, but he pre-recorded that video because upon arriving in Bali, he needed to undergo self-quarantine. Okay, so moving ahead, I'm going to try to get through the rest in about 10 plus minutes, 10 to 15 minutes. So there are two sides to Bali. One side we're all familiar with. This is the Instagrammable Bali. It's the 5-star luxury resorts. And Bali is a beautiful place with a lot of cultural resources, but there's another side to Bali. That's this side to Bali. This side is where Solemen exists and operates and provides support for those who are slipping through those cracks that I alluded to at the beginning of the presentation. These are photographs taken from Solemen's outreach team of a man who had been literally locked in that room, in that cage, for years. And I'm going to go through a couple of case studies of similar situations. Solemen refers to these patients as soul buddies. These are It's an affectionate term for the people who are under the care and the guidance and the support using the resources that Solemen has managed to amass. That is a photograph of Sarah Chapman. She's the co-head of Solemen with Robert. She oversees the outreach team. Sarah's not somebody to sit in an office. She's on the ground. She's out there in these remote villages, building relationships, extending a helping hand to those who literally have no social safety net behind them. So Soul Buddies, as you can see here, the number of Soul Buddies across Solemen's lifespan, which is nearly 10 years now, have increased dramatically year on year. So in 2020, 2,300 Soul Buddies are under the ongoing care and support of Solemen. That could be medical, in terms of medication or providing access to doctors. It could be nutrition. It could be skills training. It could be shelter. There are a number of modes of support that Solemen provides. And as you can see, geographically, they're distributed across the island. There are certain pockets, but essentially, there are no places on the island where Solemen does not travel and provide care on a daily basis. And again, all of these people are relying on Solemen on an ongoing basis. And the COVID-19 impact in terms of the funding and donations has exacerbated their situation and put them at higher risk. Before I go into a case study, I want to familiarize everybody on this call with a little known and very overlooked practice that occurs in Indonesia and a couple other. Hello? Sorry, was somebody asking a question? Jimmy, maybe you want to put your microphone on mute. Thank you.
Thanks.
So this is a practice known as pasung. In Indonesia, pasung refers to the physical restraint and confinement of criminals or mentally ill people. Now, every now and then you hear of cases like this, but I can tell you, I had heard about it growing up in Indonesia. Even in the healthcare industry, I'd heard of it to some degree, but it's always on the periphery. Nobody's really exposing a spotlight to it. However, the Human Rights Watch has done deep studies. They estimate there are 18,000 individuals in Indonesia who are subjected to this treatment today. Now, part of the reason is because in many of these remote districts, small kampungs and villages, they have no mental health services. They have no budget. The local puskesmas, which are government-run clinics, do not have the facilities or the expertise or the medication to manage those that have mental illness or mental health issues. So very common, again, 18,000 individuals, quite common for them to be restrained, completely shackled in caged rooms where they have no access to the basic necessities and the comforts or even the remote semblance of hygiene standards. And quite often they are confined to these rooms for years on end. We're talking 5, 10, 15, 20 years. And this is some of the work, it's not the only work, but this is some of the work that Solemen does. So one case study as an example is a gentleman named Pak Made. When he was referred to Solemen, he had been locked in a makeshift cell, as you can see in the photograph on the left, for many years. He had absolutely no access to toilet, water, or electricity. And as you can see, the hygiene standards are completely abysmal. He was not receiving any type of medication whatsoever. And as a result, he had multiple health issues that required urgent treatment. He was referred to Solemen. Their outreach team made contact with the village and then the family. They managed to get him released, and they brought him to healthcare facilities, as you can see in the photograph. Well, flash forward and look at Pak Made today. He was assessed and treated by a psychiatrist. He was admitted to hospital. They addressed the numerous health issues that he had, not just mental health issues. And through a process, he was rehabilitated and reintegrated into the local community. Like many of the Soul Buddies, he receives ongoing care, which includes psychiatric medication and food parcel delivery to him. And he even has a small income earned from collecting recyclables. He's very happy. He's integrated into society. He has a place. He's no longer shunned. He's able to live with dignity, and his health issues are addressed. And as you can see from the photographs, he's healthy, robust, and happy. And Pak Made is actually in the room with me. I don't know if Pak Made, you want to come wave and say hello? Everybody can see. There is Pak Made. Pak Made, salam.
Hello.
Say hello.
Hello.
It's okay, thank you. Makasih, Pak. Pak Made does not speak English, and like most of us, he's a bit camera shy. But as you can see, he's very happy, healthy. His son is with him as well. So another example of the critical type of work that Solemen is doing, plugging the gaps. Indonesia does not have the resources. Bali does not have the resources. Solemen have amassed the resources and do their very best to provide this type of care to people. Another case study as an example is baby Shanita. Baby Shanita was referred to Solemen with a very serious heart condition. And this was just prior to COVID. This is quite recently. Now, Solemen identified suitable specialists in Jakarta to manage and let's say explore her condition. Now, Solemen paid and funded all of that, including 2 trips to Jakarta for care and ongoing observation. However, this is not a case closed type of story. Shanita still to this day is at high risk. The physicians they have spoken to and coordinated with in Jakarta, they feel uncomfortable. They believe the surgery that she requires is too high risk. So Solemen, prior to COVID, was trying to identify suitable specialists available abroad in neighboring countries who could perform the necessary surgery to give her a better chance. So this is an ongoing case and an example of one of the soul buddies who desperately needs help. And if Solemen runs out of funding, this is the type of soul buddy who will be put at even higher risk. And just like Pak Made, we've asked Shanita's mother to bring her here today, essentially just to say hi. Say hi. Makasih. So you wouldn't know, judging by how cute she is, but she has underlying medical needs that need to be addressed urgently. And again, we're hoping we can elicit the help and the donations to allow Solemen to continue to look after her. I won't spend too much time on this. Robert alluded to it in his video, but these are examples of Solemen's sponsors and partners to date. Look at the brands. These are leading brands across the island. Solemen is trusted. It has the reputation. That's why all of these brands have aligned with the organization. Unfortunately, the lockdowns and travel restrictions have evaporated the local tourism economy. So 90+% of Solemen's sponsorship has completely evaporated. This is a breakdown of the internal funding. In the essence of time, I won't go through that. But to provide peace of mind to those of you who are on the call who are considering donating or potentially referring organizations or people who may be interested in donating, a few testimonials. I won't read all of them verbatim. You know, we have testimonials of support from the Financial Times, Solemen and its reputation being one of the region's most respected and popular charities. We have a testament of support from the UK Deputy Consul General in Bali, talking about the positive difference that Solemen truly delivers to the disadvantaged and at-risk communities on the island. Testimonials from people like the founder of the Seed Global Women's Empowerment Platform, who's been very supportive and recognizes the very critical nature of the work that Solemen is providing to these soul buddies, who are, again, increasing by the day. I will play a very quick, it's like 45 seconds testimonial from the former governor of Bali.
I'm Pastika, the governor of Bali. I
understand that Solemen is a great organization helping people, understand people very well, and also Solemen consists of great people that has a very good heart to help other people who are in need. On behalf of the Bali province and also the Balinese people, allow me to appreciate the effort and everything you have done. Thank you.
Apologies, I was on mute. So those introductory slides are meant to lay the groundwork, give you the context, give you the credibility, understand that it's an organization with a critical mission that can be trusted if you were to consider donating. This last component of the presentation, I'm not going to deep dive in terms of granular detail, but I will at a high level introduce the key areas that are available for sponsorship, collaboration, and donation. And these are all integrated in Solemen's 5-year prospectus and 5-year plan. The full document is available on the website at solemen.org. Number one are outreach bases. So Solemen is looking to set up multiple outreach bases across the different locations on the community, rather than consolidating care in Denpasar or in Kuta and putting mobile teams out into the field. The plan is to set up and establish outreach bases in strategic locations that will create a more efficient net and framework of care that Solemen can deliver. And as you can see, there's multiple areas within these outreach bases that can be sponsored, whether that is a worker, a base itself, a vehicle. When I mean vehicle, we are talking about mobile medical units that have the requisite equipment and medication to be able to provide care on a mobile basis, or even sponsoring a soul buddy themselves. Next, the Bali Dynasty Care and Recovery Center, which is already up and running. You know, the availability of sponsoring a room, sponsoring a soul buddy again, new vehicles, or additional workers. This is a facility where Solemen is providing care, providing shelter, and providing work to many of the soul buddies, or I should say not many, but several of them who have transitioned from being soul buddies to actually working for the organization themselves, where they have a capacity to do so. Next is the Food Dignity and Sustainable Gardens Program. This is very, very cool. If you ever have a chance, for those of you based in Bali, to visit Solemen's headquarters in Kuta, they have a number of these aquaponic gardens set up. This is an entirely sustainable food source. It does not cost much money to allow a family to have vegetables and fish on a sustainable basis, the technicalities of which I'll spare for the sake of time. But if this is something you have interest in sponsoring, we'd be happy to show you all the details, a lot of which is also up on the website. In the 5-year plan, there's also a framework for developing a psychosocial rehabilitation center, which has different components available for sponsorship. Very important, as I mentioned, the lack of mental health care resources in Indonesia as a whole, and in Bali specifically, are such that this would be one of a kind. Nothing like this is available on the island for the many people who do have mental health requirements. Lastly, if you would like to contact us, you can reach out to Robert directly. His email address is noted there, robertepstone@solemen.org. And we can discuss areas of donation and collaboration. The intent of the presentation today is not to be the end of a conversation. If you have interest in what Solemen is doing, or in any one of those components that are available for sponsorship that I outlined, we'd very much appreciate you reaching out to us. If you want to send me a direct note on this Zoom with your email address, we can do that. If you want to go to Solemen's website and contact the team via the website, we will then have a follow-up discussion with you. It's a tailored discussion to see what area you may be interested in donating or supporting, and proceed on a collaborative basis. That is essentially it for the introductory webinar. Does anybody have any questions? And if not, we will be holding further webinars next week and on an ongoing basis. Any questions?
Yes,
Okay.
there are.
Please go ahead. Was somebody speaking? Okay, I guess not. Okay, well, we sincerely thank all of you for attending. We actually had a better attendance turnout than I was anticipating for our first presentation. Please do reach out to us. This webinar has been recorded. We will be sending it to some of those who wanted to attend but who were unable. We have a list. And thank you for your time. I cannot reemphasize enough the importance of those of you who have the means to do so, to please consider donating, please consider partnering. There are thousands of people whose lives are increasingly being put at risk. So again, thank you. We appreciate it, and take care.